Hi, my name is David Gifford. I'm the Senior Vice President for Quality and Research at AHCA NCAL. The landscape of long-term care is transforming. Whether you're a skilled nursing center or assisted living, it's all about the people we care for and the outcomes. That's what quality is. But we're now caring for sicker and more complicated patients with higher expectations of better outcomes. And in order to achieve those better outcomes, we're having to partner more than we've ever done before with hospitals, home health agencies, physician groups to achieve those outcomes. Those that have focused on organizations, focusing on in-services, more forms, have not really been able to achieve the transformative outcomes that one needs to be competitive and help the individuals we care for. Those who look at their organizations, focus on the systems, focus on the teams, focus on how the teams work together to get the work done every day, really outperform those that don't. You can continue to focus on individuals as we've done in the past. Develop new forms, do more in-services, discipline the staff, but we've never really been able to achieve the big changes with that. Organizations that focus on systems, how you provide care, really do very well. Study after study continues to show that organizations in healthcare that focus on how they provide the care, what are the processes they use, how the teams work together, focusing on the staff, outperform those that don't. That's what we mean by organizational systems. This is why we're promoting the Baldrige framework. The Baldrige framework focuses on these systems and is the basis for CMS's QAPI regulations and the basis for AHCA's Quality Awards program. What is the Baldrige framework, you might be asking? The Baldrige framework really is an interplay of 7 different areas. It's making sure that organizations focus on having a plan, that they have leadership, not just at the top, but down in each of the teams, that manages the staff, that manages the systems, that addresses what's out there, that the organization really focuses on the workforce. I can't emphasize enough the importance of focusing on the workforce. Focusing on the customer, how are they measuring customer satisfaction, how are they incorporating customers' views into what they need is really key. And then without this, without good measurement, you don't know whether you're improving or not. And then you need to be monitoring, celebrating those success, measuring the results, achieving the results you want. And then clearly, this is all embedded within focusing on the operations. If you're not focusing on your general operations, how you do things day in and day out, you're not going to achieve the outcomes you want. In AHCA's Quality Award program, we see that those that achieve the silver and gold outperform facilities that are similar to them but did not achieve the silver and gold. They have fewer deficiencies. They're more likely to be deficiency-free. They have higher occupancy. They have higher revenue. They have higher profit margin. They have better payer mix. They nearly perform better on all the quality measures that are used out there. But most of us are now being measured on 5-star. And if you look at the overall 5-star rating, what you'll see is that silver and gold winners, 73% of them are 4 and 5-star, whereas only 43% of those who are not are 4 and 5-star. You're almost twice as likely to be 4 and 5-star if you are a silver and gold winner that's out there. Now, you might be saying, well, how does this all apply? How do I apply it in my organization? I like to think about it from a clinical standpoint, being a physician. Treat the unit, your organization, very much like we would do a patient. First, in a systematic approach to quality, one would review the performance of the organization. You would look at that performance, and then based on it, if you're not achieving the results you want, you assess the system. How was the process? What was going on about that? You formulate a treatment plan. You implement the treatment plan and pilot test it. You then evaluate those changes. And if you achieve the results you want, you disseminate it throughout the organization. So I've never seen a program work as intended. Almost always, after you pilot test, one has to make modifications, changes, formulate a new plan, pilot test it again, and measure how one's doing to see how they're doing. And then eventually you get it right and you can disseminate it throughout the organization. Organizations who would do this approach will slowly but systematically get better than those who don't. We're going to know you're successful in this systematic approach when, for your short stay rehab patients coming from the hospital, you reduce rehospitalizations, you get more people being discharged back to the community, you see improvements in their functional status, they improve mobility, self-care, and we're going to see better customer satisfaction. For your long stay residents, you're going to see lower antipsychotic use, better dementia care, more families engaged and happier with that, and you're going to see lower turnover. And again, that lower turnover is really critical to achieving the quality you need out there. But that's not all. We are seeing more and more this business case for quality. Congress recently passed legislation that applies a 2% withhold to your Medicare payment rates, which you can get back if you achieve higher quality, which is they're going to be measured by lowering your rehospitalization rate. By lowering your rehospitalization rate, you can get that withhold back. If not, you're at risk of losing that 2% withhold. Network selections by ACOs, MCOs is now being driven by quality decisions. HUD is making loan decisions on your quality ratings. Liability insurance carriers are making decisions on quality. Hospitals are now partnering with both assisted living and skilled nursing centers based on their quality and their perceptions out there. And then higher quality organizational systems have lower deficiencies, and there is a cost with each deficiency, as we all know, out there. But let me show you exactly how this applies to you. So this is data that looks at all of the SNFs in the country, and it looks at their rehospitalization rate, and looks at how many SNFs have different risk-adjusted rehospitalization rates. And you can see all the way on the left, 127 skilled nursing centers have risk-adjusted rates below 5%. That's really impressive. But at the other end, on the other side, you see 33 skilled nursing centers have risk-adjusted rates above 35%. Now, those who are at risk of not getting the 2% back, who are not going to be in the networks with ACOs, managed care organizations, are those who have risk-adjusted rates over 20%. Now, the others who don't keep up may be at risk too, but certainly if you're over 20%, I'd be worried now. And this is the time to focus on that. So you might be saying, where can I get my results? Well, for skilled nursing centers, we have Long-Term Care Trend Tracker for you. And Long-Term Care Trend Tracker, it has not only your risk-adjusted rehospitalization rate, not only how many people you discharge back to the community, length of stay, but it also has your survey history, your resident characteristics, staffing information, CMS 5-star ratings that are out there. And you're able to benchmark yourself to peers. You can compare yourself to any of the peers you want. You can see how you're doing over time. And you can also begin to see how top performing centers around the country are doing as well, and how close you are to being a top performing center. For assisted living, we have the PSOs, or patient safety organizations. And the PSOs really help, you have to submit data to them. They can benchmark yourself against others. You can see how you're doing over time on a wide array of measures. You can look at rehospitalization rates. You can look at antipsychotic use. You can look at pain, pressure ulcers, falls, medication errors, a whole set of measures out there. And we encourage you to contract with the PSOs to get that information. Measuring and knowing where you are is not enough. You actually need to make changes, and AHCA NCAL has a number of tools to get there. Probably the most important area to focus on and start with is on turnover. And let me show you why. There's a strong relationship between turnover and quality. And if you graph quality on the vertical axis here and turnover on the horizontal axis here, where higher on this vertical axis is worse quality, and further across is higher turnover, what you see is this little U-shaped graph. And what that means is, early on, when turnover goes from about 0 to 20%, you can see actually quality getting a little bit better. Remember, going down is better. And then from about 20% over to 50%, you don't see much change in quality. But at 50%, it takes off and quality gets a lot worse. This is why experts recommend that most people should keep their turnover between about 20 and 40%. Now, there's a cost to turnover. At AHCA's NCAL's website, there's a cost calculator that you can look at the cost of turnover and calculate what it costs in real dollars to recruit people, train people, and do those issues. And we encourage you to visit and see what the cost of turnover in your organization is that's out there. We also have a number of tools on the website that are step-by-step process from the hiring all the way through to keep people on board and retain them and lower your turnover. And people who've used those have seen dramatic improvements in their turnover. We also have tools to help with lowering antipsychotic use. If you go to AHCA's NCAL's website, we have a consumer fact sheet in both English and Spanish to be used in both skilled nursing centers and assisted living that explains the risks and benefits of antipsychotic use in dementia. We encourage you to use it. It's very informative out there. We also have a number of other tools to begin to evaluate how to get people off antipsychotics, how to treat individuals with dementia differently so you can lower your antipsychotics. But let me show you what happens when you do this approach. This graph shows the number of skilled nursing centers who have changed their antipsychotic use over time. On the left side, the downward bars are all the skilled nursing centers that have lowered their antipsychotic use over time. On the right side, the upward bars are all those who have increased their antipsychotic use over time. And what you can see is there's a really large bar on the left. If you get it and do these organizational systems, you will have dramatic improvements, greater than 30% reductions in your antipsychotic use. Those who are not able to really address the staff turnover, the organizational systems, and get that, are stuck in the middle with no change, or worse, getting worse with an upward bar. I want you to be on the leftward side. I encourage you to visit our website to get information on how to become a transformed center to lower your antipsychotic use. So, we've been talking today about this really transforming landscape. This quality is not just about improving outcomes for our residents, but it's also making sure that you don't suffer payment penalties, you stay in networks and go forward with this. And we have a number of resources at AHCA's Quality Initiative website. We encourage you to visit it. I wish you good luck on this journey. Call us if you need any assistance, and I look forward to watching continued improvement over time. Thank you very much.